What tests are used to detect atherosclerosis? If you are curious about how doctors find out if someone has atherosclerosis, you are in the right place. Atherosclerosis is when fatty deposits, or plaques, build up in the arteries, often linked to high cholesterol and hyperlipidemia. Detecting this condition involves several tests that help assess the health of your arteries and heart. First, blood tests are essential. These tests check your cholesterol levels, including low-density lipoprotein, which is often called bad cholesterol, and high-density lipoprotein, known as good cholesterol. They also measure triglycerides and blood sugar levels. High levels of cholesterol and lipids can indicate a higher risk for atherosclerosis and guide further testing. Next, an electrocardiogram, often referred to as an EKG, records the electrical activity of your heart. This test can help identify any irregularities that might suggest reduced blood flow due to narrowed arteries. Stress tests are another important tool. These tests monitor how your heart functions during physical activity. By exercising, doctors can see if there are areas with poor blood flow caused by blockages in the arteries. Doppler ultrasound is a non-invasive method that measures blood flow in your arteries. This technique can identify narrowed or blocked arteries by detecting changes in how fast blood flows. The ankle-brachial index compares blood pressure in your ankle and arm. This test helps detect peripheral artery disease, which is a form of atherosclerosis affecting the arteries in your legs. A coronary calcium scan, also known as a heart scan, is a specialized computed tomography scan that looks for calcium deposits in the walls of your coronary arteries. The amount of calcium can indicate the extent of coronary artery disease and the risk of a heart attack. Cardiac catheterization and angiogram is an invasive procedure where a thin tube is inserted into your blood vessels. A contrast dye is injected, allowing X-ray imaging of the coronary arteries to show areas of narrowing or blockage. Magnetic resonance imaging and magnetic resonance angiography provide detailed images of your arteries and plaque composition without using radiation. These tests visualize blood vessels to detect any narrowing or aneurysms. Positron emission tomography and single photon emission computed tomography are functional imaging methods that use radioactive tracers. They assess inflammation and metabolic activity in arterial plaques, which can indicate their vulnerability to rupture. Other advanced imaging techniques include optical coherence tomography and intravascular ultrasound. These methods provide high-resolution images of artery walls during catheterization to assess plaque characteristics. Near-infrared fluorescence imaging can detect molecular markers of inflammation in plaques. From the perspective of hyperlipidemia and cholesterol, these tests are vital. Elevated lipid levels contribute to plaque formation, and blood tests for cholesterol help assess risk. Imaging tests reveal the physical impact of lipid-driven plaque buildup. Early detection through these methods allows for timely interventions, including therapies to lower lipid levels, helping to prevent the progression of atherosclerosis and related cardiovascular events.